So with that, I would now like to begin our panel presentations. And the first presentation will be from the City of Santa Clarita, and that will start with Captain Paul Becker. Go ahead, Paul.
Thank you, Ken. In 2010, the Santa Clarita Valley Sheriff's Station realized that the process that we had in place to combat narcotic usage and addiction simply was not working. As Ken mentioned, we had a significant number of overdose deaths, and we had a startling number of overdoses showing up in our emergency rooms every day. We also identified that a large majority of the addicts that we found in their 20s were using marijuana and alcohol as early as 12. And it seems like 12 was the time where most of them said they started using. And to us, that was very surprising. We reevaluated how we were going to impact the issue of narcotics in the Valley, and ultimately we created, as we spoke about, the Juvenile Intervention Team. The concept of the team was to branch out and move on from just enforcement. Although enforcement was a very important component, we knew that we had to add other components, and that was the intervention and the education component to the plan. So as we talk about in Santa Clarita using that three-pronged approach of enforcement, intervention, and education, I'd like to go over those very quickly to talk about what we're doing in each one. On the enforcement component, the J team, the Juvenile Intervention Team, handles all issues where drugs are getting to school-age kids. If that comes across in the Valley, then the Juvenile Intervention Team gets into that and deals with those cases specifically. The enforcement component of the team has 2 deputies, 1 detective, and 1 team sergeant. We also reorganized the school resource deputies, of which we have 7, and placed them under the command of the Juvenile Intervention Team. By doing that, we were able to utilize the school resource deputies as force multipliers within all of our high schools and junior high schools that the J team can go to and work with. We also began an aggressive and automated tip reporting system. This was very, very important, and it's been very successful. We use lacrimestoppers.org, and starting in August, we'll be looking at a text tipping program in our high schools and junior high schools. The last component of the enforcement side was utilizing a tracking system which better addressed at-risk students, recidivism, intervention issues, and it also kept the school resource deputies informed of school-to-school transfers throughout the district. On the second component, intervention, the City of Santa Clarita hired an intervention officer. That intervention officer has extensive law enforcement experience with the LA County Sheriff's Department and narcotics experience. And the role of the intervention officer was to take these kids that would normally be heading to juvenile court and diverting them and getting them the help that they need to try to get them straightened out. In 2013 alone, we've placed 50 kids in counseling for narcotics and alcohol issues, 3 students in intensive outpatient programs, and 16 students in resident programs. One interesting, we assigned to Henry Mayo Memorial Hospital to work for a shift with the emergency room doctors. We just felt that was the right thing to do so that that student can see what comes in through that emergency room. On the education component, in November of 2011, we really got looking at programs throughout the nation that might be effective in the Santa Clarita Valley. And we found a program in Dade County, Florida called DeFi-IT, Drug-Free Youth in Town. We sent representatives from the J team, 2 deputies, 2 representatives from the City of Santa Clarita Community Services Division, and 1 representative from the Hart School District back to Dade County for the period of a week to monitor that program. Once that was done, we realized that this was the right program. We needed to bring this program to the Santa Clarita Valley, and ultimately we did that. To my left, I have Ingrid Hardy, the Superintendent of Community Services. Ingrid was part of that contingent that went to Florida. And we have Kathy Hunter, the Director of Student Services for the William S. Hart District. Kathy also went to Florida to take a look at that program and was instrumental in building that program in August of 2012 in the Santa Clarita Valley. So I'd like to turn it over to them to talk about that.
Thank you, Captain. As the captain mentioned, we are responsible for the implementation of the Defiant program. The City of Santa Clarita also has other programs that complement what our nonprofit organizations are doing in the community as well as in the schools. The Defiant program is a program that educates, empowers, recognizes, and celebrates drug-free students. Through this program, the students develop resiliency skills, leadership skills, critical thinking skills, and a strong foundation for living. The program is targeted towards junior high and high school students, and as the captain mentioned in his presentation, through their research, they were finding that most kids were experimenting by the age of 12. There are several components to the Defiant program that are vital to its success. The Defiant program is a club-based program. It is valley-wide. The program is implemented in all of our junior high and high schools in the incorporated and unincorporated areas of Santa Clarita. The program includes community service hours, education awareness activities, social events, school assemblies for elementary students to engage those students in the Defiant program and to serve as a recruiting tool. And it also includes a random drug testing component, which is a great tool for the students to to refuse drugs, to say that, they're going to be tested, and it also serves as a good measuring tool for the city to determine if students are actually staying drug-free. The program for the City of Santa Clarita, as well as its partners with the Sheriff's Department and the school district and Superintendent's office, is a great collaboration between all of the agencies. And as Ken Striplin mentioned earlier, it does take a village to raise our children and to wrap our arms around the growing drug issue. Some of the other programs that the City of Santa Clarita is responsible for implementing are the Heroin Kills program, which is a campaign, and it includes a symposium where we bring together a panel presentation of different disciplines in the community. It also includes a resource fair. We have several media ads that provide that shock value that we need for the community, and it also provides resources through the website. We collaborate with many nonprofit organizations on the implementation of this program, as well as our other partners at the Sheriff's Department and the school district. The city also has a Blue Ribbon Task Force that was formed by the City Council in 2000. This is a group of stakeholders that includes parents, law enforcement, community-based organizations, businesses, and city staff that provide resources to the community in terms of alcohol, tobacco, and other drugs and how that's impacting teens. Over the years, the scope of the group has expanded to include issues such as stress, gangs, sex, and other factors that may play into the experimentation of using drugs. The Blue Ribbon Task Force is responsible for an annual event called Teen Scene Unplugged, and they are also the group behind the Youth Grove, which is a memorial at Central Park that serves as an educational tool about the consequences of drinking and driving. Through all of our programs, we have experienced a great amount of success. With the Defiant program being in its inaugural year, we're actually quite pleased with the results. For the first year of the program, we had 800 members enrolled in the program. They served 2,480 hours of community service. The members shared the Defiant message with 24,000 junior high and high school students. And we recognize that not all teens are going to sign up for this club, but if they have the ability to share the message and impact the student bodies in which they are involved in, that we are helping to shift the culture on our campuses and for kids to understand that majority of them are not doing drugs, and that if they can feel that it's cool and it's okay to be drug-free, we're shifting that mindset for the students. This year, we move forward with our random drug testing as part of the program. 100% of the members that were randomly drug tested had negative results. And finally, one of the measures that we use for the Defiant program is a pre- and post-test. And what we found at the end of the program is that 91% that all the students answered the questions correctly for 91%. And during the pretest, the number of questions answered correctly was at 60%. So they are learning what we're teaching them in the Defy It program, and again, we're quite pleased with the results of that program. So I'm going to turn it over to our other partner, Kathy Hunter, with the William S. Hart School District.
Good morning, everybody. I do have a PowerPoint presentation that I'm going to go through with you, but what I would ask is please stop me along the way if you have questions so we can make this an interactive conversation. I would rather do that rather than just talk at you with a bunch of facts and figures. So I'm hoping we can all really learn from each other. I feel very fortunate in my position that when I came on board at the district office over the area of student services, that it happened to be the same time that Captain Becker came to the Sheriff's Department and Ingrid Hardy came into play into the area that she's in now that works with me, along with Janine Prado and Bob Walksmith and Dan Stanley, who's back there, and several of our other officers, Mr. Velick, that this happened to be a group of people, for whatever reason, that were all very attuned with each other, that were all very action-oriented, that we're not a group of people as individuals that you put us on committees and we just go to committees and sit and talk about things and not do things. This whole entire group were like, all right, we have a problem. What are we going to do about it? Here's some solutions. Let's get out and look at them and let's put it together. And that's really what we've done, I feel like, as a collaborative group, is get away from talk and get into action. And that's what we want to share with all of you today, is all the steps we've taken. As a school district, we've really tried to look at this as a gigantic umbrella, and that umbrella keeps expanding, and we're just cramming everything underneath it that we possibly can that will work. Because all of you who work with youth know there's no one size fits all, so we keep coming up with this and this and this and this, so we have something different for everyone. The conversation that I was brought into started at the Blue Ribbon Task Force that Ingrid mentioned, which is a group of people all dedicated to trying to provide resources for our youth, particularly in the areas of substance abuse prevention. And was Frank the mayor at the time? Our mayor at the time basically challenged me as the school district representative. It was my first time at the meeting. I'm sitting at the end, and he basically said, what are you going to do about the problems with, youth in our valley? At that particular point in time, which was 2008-9, I said, we have no money. We would love to do tons of things, but as you know, school districts were, funding collapsed, and I said, if we can work together, and he said, I'll put the money up if you'll put the work into it. And I said, you've got a deal. And that's where we went from. And then we ended up spreading that out with Captain Becker. Ingrid got involved, and Janine, et cetera. And that's when we started researching what program did we want to put in place and how to basically be able to fund that and offer it to as many students as possible. Our district started with the Cadre program, which is let's see if I can remember, comprehensive alcohol and drug reduction education. And that program started in 2007, and we received a federal grant for that program. It's a voluntary drug testing program that we offer to all of the students in our district, which is 23,000 students. Their parents can just sign them up whenever they register them for school. Once you're signed up, you stay signed up all 6 years of, school that you're with us from junior high through your graduation, unless your parent opts you out. No cost to the parent. There's no disciplinary action involved. It's a totally confidential service that we offer to parents. So basically, if you, the parent, sign your child up, then the name goes over to the laboratory. They'll come to the school periodically, call you out of class, take a sample, and then if your sample comes back dirty or clean, they'll call and notify the parent of what the results were, but it never comes to the school. So even though I manage the program, all I ever get is numbers. I don't ever know what students are enrolled or not enrolled and what the results came out. And so it's really been just a great service that we offered to our parents in the community and for our students, because again, they can tell their friends, hey, my parents have me enrolled in this Cadre program. I could be drug tested any minute. I can't do that. So the kids who haven't developed the ability to say no on their own, it gives them another way to do it. And so we're really happy with that. That particular program, Cadre, also has two other functions. If a student's test comes back dirty, then the parent also is offered to bring the child in, and they offer a free counseling session, and they really do an intake. They try to assess where the kid is at with drug use. Do they need inpatient? Do they need outpatient? Do they just need some education, et cetera? They offer that to them and then make referrals. And then the third part of that one is just general awareness and education. So we put on multiple webinars, which we found to be more effective than going out and doing PTA meetings, et cetera, where we'll take a hot topic such as bath salts or the difference in marijuana today and what we saw as marijuana in the past. And we'll do a full-hour webinar where parents participate live and they can answer questions, ask questions, et cetera. And we do that, try to do it quarterly. And then we post it on our website so that people can access it anytime they want. So that's the education piece. That program began in 2007, and it's still going strong today. We did run out of money from the federal grant. Obviously, we spent all of it, and so now we are funding it through a foundation who has earmarked money, which the way it works for us is when the district has to buy something really expensive, we use our American Express card so that we can get the points, and then we take the points and convert them to dollars and put them in the Wish Foundation. And then that money is earmarked to pay for the Cadre program. So it works out wonderfully, and we see it as being long-term sustainable. This particular program has gotten a lot of publicity, and so I'm going to show you a short video to start that was put this was put together, then can you back it up? By the Canadian Broadcasting System. They came out, they had heard about our program somehow and wanted to come out and find out about it.
It can happen in any class, on any day, at any time. Someone will come and get 13-year-old Kennedy Beck and discreetly tell her it's time.
You have to pee in a cup.
To be clear, Beck has never done drugs and doesn't plan to, but she's agreed to take random drug tests.
I thought that it was like a good excuse for me to say no to drugs because I could tell them that I was getting drug tested and my parents would find out.
If Beck ever tests positive for any drug, her mom will get a phone call.
I'd love to be the bad guy. If it's positive for her, I'll be the bad guy any day.
A quarter of the students at this junior high school an hour north of Los Angeles have signed up for random drug tests, and a growing number of schools across the U.S. have similar programs. The testing is done by a private company hired by the school, but the school never learns who's on drugs and who's not.
We're not told specific names, but we do get the data, we get the numbers.
The principal says even those basic statistics are valuable as indications of how big a problem drugs are at the school. Kids that do test positive aren't turned over to the police. Instead, their families are directed to counseling and detox programs. The school district covers the tests, but Kennedy Beck's mom says she'd pay for it on her own in a heartbeat.
I'd rather know now before it would become a habit or an addiction or something like that, so that I could get her help.
Civil rights groups have raised privacy concerns, but Beck says she's happy to give up a little privacy if the first time someone tries to pass her a joint, she has a good excuse to just say no.
Okay, so that is the Cadre program, and before I move on to our other programs, is there any questions anyone has about that program, which we will continue to administer long-term? Right now, we have about 10% of our students enrolled in it. We have 23,000 students in our district, and we have about 2,300 actually right now that are enrolled. And we really push the enrollment out when kids come in 7th grade. That's the best time, is to get them right when they enter junior high and let them know, as far as for parents, to tell their kids that obviously I trust you, I know you're not using drugs, I'm doing this as a benefit to you, and it's really one of those things that's not even intrusive to kids in 7th and 8th grade. The parents who try to sign their kids up when they're juniors or seniors, it gets a little bit more complicated because then it's like, oh, you don't trust me and all those kind of things. But we found it to be really valuable to sign them up in 7th grade.
What do you pay for a drug test?
Actually, it comes out right now to be $20 per test. We spend about $25,000 a year because they are tested randomly.
It's completely voluntary.
Completely voluntary.
Does the school district do any kind of testing on athletes or any kind of extracurricular activities as a...
That's how this program got started, is that issue came to our governing board. to look at actually taking advantage of the federal opportunity to test athletes and people in extracurricular, and they didn't feel like our community would support that because it's isolating a particular population of students, so it's not really very equitable. And a lot of the students who might be engaging in drugs are kids who are not participating in those types of activities, such as athletics. So they felt like they were really bothered by the inequity of it, that you would penalize a student because they are involved and engaged, so you're testing them, and the kid who is not engaged, you're not testing them, so it seemed very unfair. And based on that, they decided they didn't want to take advantage of it, so that's when we started investigating what else could we offer our community to help with the problem, and that's when we came up with the grant for Cadre. Yeah, so we don't do that. Yeah. Anything else?
Once they're enrolled, are they enrolled through graduation?
Yes, unless the parent signs a form to opt out, which I think I've had maybe 2 or 3 forms ever where a parent wanted to opt their child out. They're in it the whole time. Yeah. Anything else?
Have you had any issues with once students turn 18 and they're in high school that they no longer want to participate in the program on their own?
I haven't had any of them actually themselves opt out, but they are allowed to do that as soon as they're an adult, but none of them have made that choice.
Kathy, I think you referenced a number of 10% are participating in the program. What do you attribute the 90% for not participating in the program?
Marketing. When we started the program, we had the first goal was to have 3%, and so our goal after that was to raise it 3% every single year. And last year was the very first year where we actually started taking the form and making it part of the enrollment packet. So when the parent gets the 15 forms, it's one of them that they can go ahead and sign, because we found out that if you obviously advertise the program and then expect the parent to go on the website, download the form, fill the form out, and send it to the lab, it doesn't happen. So we kind of help facilitate that, and I think we'll continue to see a rise since we started that this year. Okay, we'll go to the next. All right. Defy It obviously has already been talked about a great deal. I took this picture because of the students doing so much community service, that we've really seen a value with the Drug-Free Youth in Town program because of the fact that it is so comprehensive for students, that it gives them something that's really positive to put on their college applications. It's something that offers social opportunities. It offers the community service. It offers leadership. It's not just the drug component, because when we all did our research, one of the things we found is, one, most kids aren't doing drugs, but most kids think everybody else is doing drugs. And so it was to try to get that message out there from kids to kids. And the other part of it is that the kids themselves were saying, why isn't anybody ever looking at the underlying reasons? Adults continue to say, don't do drugs, it's bad for you, no, 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 but they don't ever find out, why are you doing drugs? Well, we spend a lot of time talking to kids to find out, why did you choose to do it, and why did you choose not to do it? And the kids who chose not to do it, it's because they were involved. They were involved with their community, they were involved with their church, their family, they cared what other people thought, they had goals set for their lives. The kids who chose to use, most of the time were bored, uninvolved, disengaged, and those are the things that we wanted to target with this program. For us to have launched this literally this year, we put this thing together amazingly quick and had incredible results. I wish we had students here actually to talk to you, because I find that to be much more valuable. But one of the kids the other night at actually what was the council chambers for Parks and Rec or something came, and what he was telling them was, I've never done drugs, and people want to know, well, why am I in this and why am I being educated about it? He said, I'm educated because while I don't do them, 20 of my friends do, and that way I can tell my 20 friends myself and not come from an adult why they shouldn't do this and how to avoid doing it. And so they've really had some invaluable insights into how wonderful this program is for them. So we have high hopes that as we continue it, the clubs will just grow and expand, because the ultimate outcome we would like really would be some type of a paradigm shift for the kids themselves, so that they really truly do understand that most kids aren't doing drugs and that they don't need to do drugs to be able to have fun. Because what they also told us at the different times we talked with them is, they do it a lot out of curiosity because everything they watch on TV, movies, and even their parents' parties at home kind of leads them to believe that the only time anyone's ever laughing and having a great time is if they're using some kind of substance, whether it be alcohol or some type of drug. And so they get the idea of, I want to have fun, and if that's how you have fun, I want to do it too. So we have to really shake that image up and get them to understand that what the reality of it is rather than what they think it is. And so I'm not going to go into this program a whole lot more unless you have questions, because they've already covered that, but that is kind of our brand new effort in the war against drugs. So if you'll click that for me. Okay, TIDE, we also started this year, really and we put it together real quickly. Also, we have a partner in the Valley, Action, which is Action Family Counseling. I think you guys have access to them as well. We're very fortunate that Kerry Quashen is so dedicated to ending substance abuse among our teens that he is willing to donate lots of his money and his time to do things to help us. And we came up with an idea that whenever we have students at school who are caught with a substance, whether they're using it or in possession of it or selling it, that what we do right now is suspend them for 5 days and then decide if there's going to be additional discipline. And so during that 5 days, what are they doing? Sitting at home, probably using drugs. So we decided, not really such a great idea. So we thought during the days that they were having the suspension, instead of them sitting at home, why not make them go to a program that's going to educate them on drug use? So TIDE stands for Training and Intervention in Drug Education. What it really means is you're going to turn the tide in your life and go the opposite direction. And we have 2 of our officers that actually go every single week over to present to the kids, along with 3 of the different counselors from Action. They run the program from 8 o'clock to 2 o'clock. It's every Tuesday, Wednesday, Thursday. So if a student gets referred because they have drugs on campus, they are there for those 3 days. And in that way, the suspension goes away because it turns into actually being an educational opportunity, and we're able to recoup our ADA for it as well. Plus, it's serving the kids to hopefully change their behavior rather than just having them sit at home for those days of suspension. So we're really happy with this program. We started it probably like in the middle of the first semester. We run about 12 kids per week through the program, and the feedback we've received from parents and from kids has been fabulous. They really feel strongly about the value of the program, and I think recidivism on it, we've had maybe 2 offenders that I know of that have went through the program and then have reoffended. They do have to provide us with a certificate of completion after they go through the program, and anyway, it's just an awesome program that we've come up with, and right now it's free because Mr. Quashen is willing to do it for us for free at one of his at his Action Family Zone that's out here. So, any questions on that program? Okay, let's go to the next slide. All right, Action is also on our campuses. We have a continuation school, and they provide counseling there every single week. And then we have Heart High, where they have a Spanish speakers only Action Family Night. And then at Canyon High School, also once a week, I think on Tuesday nights at 7, they're there. And this is an opportunity for parents and for students to go through and have the support group type of facilitation that is, they divide the kids in one group and then the parents in the other, and then they have counselors who work with both groups. And so kids who are already having issues with substance abuse, or if there's substance abuse in the family, run through these programs. They're also free, and the kids can also get their drug testing through there if they're being mandated for drug testing. We also started something that I'm going to pass out to all of you, which came actually as a result of the conversation I was telling you at the Blue Ribbon Task Force with Mr. Ferry, that one of the issues in our valley became our response whenever a student was caught with drugs at the school site was, 1, suspend you, and then as soon as your suspension was over, we would just send you to another school. And so we have 6 high schools, and one student might have visited all 6 because every time they got in trouble, they just went from school to school. Well, again, not a solution that was actually working in any way whatsoever, other than to say, you're now off our campus, you're somebody else's problem. We decided all the kids in our district are all of our kids, and we're going to work with the kids within their neighborhoods. So we developed what's called a suspended discipline transfer contract. And if a parent opts to sign this along with their child, it's a collaborative type of contract. They all negotiate it together, basically. So whatever the issue is, they agree to go to TIDE, they'll agree to have drug testing, they agree to go to counseling, they might agree to lose their off-campus privileges, they might agree to backpack checks. It's whatever we think fits for that particular child. So they just check off the items that the three people, which would be the administrator, the parent, and the student, agree to as far as the terms. And if they do that, then we don't move them to another school. They're able to stay at their home school, and then they just meet with one of our SROs who are extremely involved on all of our campuses. So the kids on contract, all their names go to the officers, and the officers then can call their caseload in like once every couple weeks and check and see, have you had your drug test? Are you staying clean? All of those type of things. So I'm going to pass these out just so you guys will have a copy of those, and you can ask any questions later that you might have on them. Okay, if you go ahead and click to the next screen. It's one before that, there. Obviously, what we've all been talking about is community partnerships and how imperative that is for making change. Here, we've already talked about Blue Ribbon Task Force. We have our heroin kills. We do actively participate at our schools with the every 15 minutes. We have the Youth Grove, which is dedicated to students who have lost their lives to alcohol-related traffic incidents. And so kids go there as a memorial, a very moving type of service. We have Safe Rides here that we really heavily advertise for our students to take advantage of if they have went to a party and consumed alcohol, etc. Action works closely with us, the J team. We, as I think Captain Becker just stated, and Sergeant Stanley, you want to stand up? We met yesterday to look at implementing Text-to-Tip, which we got the idea at a Cal Lutheran seminar that we went to on safe schools in Orange County's using, and it's free through Google Voice. So we're looking at putting that in to help us with a kid who wants to text the tip saying, hey, I saw a drug deal going down, or I know about this fight that's about to happen. And so we're going to be looking at starting that at Valencia High, hopefully right when school starts in August. And Interagency is another resource we have here that is, I think, unique to our valley, that it's mental health, it's regular hospitals, it's law enforcement, probation, child and family services, regional center. It's all the agencies come together, and we actually just discuss really high-risk cases that are going on in the valley, and all the different agencies work together to offer something to those families to try to help them get out of the situation they happen to be in. And then last, obviously, we have a huge referral base that's beyond what's up there, but we do have our ERICS program, which is our educationally related intensive counseling services, our Child and Family Center here, which is very active, Action, A Light of Hope, which is another one of our partners in the fight against substance abuse, Phoenix House takes a lot of our kids in for residential, Straightening Reins, which is an incredible program that uses horses as therapy for kids who are making some poor choices, and then our youth employment service we use a lot for referrals, because we do believe that if kids are disengaged at school, if we can get them engaged in work, they're engaged and they're going to be less likely to do drugs. So we really are trying to look at a really comprehensive program and just continually adding components to it. And I appreciate all of your attention. If you have any questions about any of our programs, I'm happy to share with you.